Okay, I got that. Yep. Perfect. Once it hits that thing, it's perfect.
Mm-hmm.
Yeah, there it goes. Perfect. All right, we're just gonna wait till everyone gets on before we get started. Give it a few more minutes.
What's that mean? Send a request to be in your live video. Should I put?
Yeah. Yep.
Go live?
Yeah.
Okay.
Why not?
Okay.
It's so silly.
That's what that is.
Okay.
Oh, so you can really talk to us. That's what they want.
Oh, right. Okay.
Got about 1 more minute.
I don't use these in between.
How are you?
Use them right now if you want it. It'll just make it cold. It helps. Okay. Yeah. That'll help.
All right. We'll master this by tomorrow.
Longest minute ever.
Right? Oh, you got it. Okay. All right, we probably. I'll follow you.
Okay, we're gonna start.
Hello, Dr. Spellman again at Hillstrom Wright Plastic Surgery, and we are going to do a demonstration today with the filler Restylane Kysse, and it's one of the newer FDA-approved fillers for lip augmentation. And we have Erica here. We've already chatted beforehand to kind of go over what her expectations are and what areas we want to augment and what effect she's looking for and all of that. So when you come in, we will numb you up, get you nice and comfy, and go over where you want the filler placed, what your ideal look is going to be, and then on our end, we try to help you to determine, yes, that will look good, or I think you should also do this, or kind of just collaborate with you to figure out the best plan going forward. This is the first time for her, so we're not going to be going crazy here. We're going to start subtly and then have her come back in a couple of weeks and make sure that she's happy with the procedure, and we can do any touch-ups at that point. Then if someone's coming more regularly, we kind of have a plan developed and we can kind of follow that going forward. So if you don't want to come back after that 2 weeks for touch-ups, you don't have to. It just serves as a guide going forward so you are pleased and really happy with your results. So now I'm just going to start. I'm going to clean everything off. We have the numbing on there still and get her ready. So there goes the numbing, and we put lots on there.
And if anybody has any questions, feel free to ask them, and we can answer them during the live or even after.
Sorry.
Can't feel it, so that's
That's good. So one of the questions we go over when patients come in, especially for lips, are kind of the ratios. You know, the normal ratio for lips is either going to be a little bit fuller lower lip or kind of equivalent lower and upper lip. So we went over that, and with Erica, she somewhat has already pretty symmetrical and even upper to lower lip. Some people have basically like a 2-to-1 ratio where the lower lip is larger by almost twice. And we kind of try to maintain whatever ratio they're looking to maintain. So we went over that as well, and we're going to kind of maintain equal proportions there. And we're going to get started. You think you're ready? All right, I'm going to have you put your head back so you don't want to. And And I'm gonna get started. So here we go. And you're already doing it. And I always withdraw just to make sure I don't get any flashes of blood, and I didn't see anything there. And just kind of go slowly. Doing okay?
Mm-hmm.
Good. And I'm just kind of doing the same thing as I go. I'm just withdrawing and kind of getting them equivalent to where I want them from the upper and the lower. And then I'm going to jump over there so I can see better over there. And I can't reach from side to side, so I have to go around. But some people probably are tall enough they can stand in one spot. I can't. She's doing a really good job.
It looks so good.
And then once I do a little bit, I kind of will step back and kind of look and see what we've got so far. And I will also show the patient what we're doing too, because you know, you can see right away what it's gonna look like. Granted, there's a little bit of swelling that happens, but I can show her and she can say, oh, I want more, or oh no, this is good, let's stay here. So we'll do that too. We need a little more lower here. And then I'll show you. And the lips do, you know, get little pinpoint bleeding here and there, and they're just, I kind of just will hold that to prevent any bruising. So that's what I'm doing right now. But they're not, you know, she's not really having a lot of bleeding at all. But I'll do things like hold pressure. I'll talk to patients about arnica before and after. Pineapple, I've heard. I don't know if that's true or not, but it's not harmful to eat pineapple, so why not?
Yeah.
So I'll tell people about it because I don't really care if there's double-blinded studies on pineapple.
Yeah. And being hydrated.
Right, hydrated, definitely. A little bit more on this side, and then I'm going to give you a mirror, and you can then tell me how you feel. And then what I'll do is I'll massage them too, so it feels nice and even. Because the lips are thinner in comparison to the cheeks, so you can feel lip filler in. You can feel filler in the lips more so than you'd be able to, like if you did your cheeks with a filler. So I'll smooth that out. What do you think?
Great.
You happy with this size?
Yeah.
Okay, so I can massage that in, and then I can do a couple of things too. I can also augment the Cupid's bow area if you want, or we can just leave well enough alone and check in a couple weeks.
Yeah, I'd rather like
Perfect.
wait and then check it out.
So that's just how we do it. You know, we do the procedure. In real time, she can look. She can tell me, no, I'm happy with this, or no, I actually like a little more here. And it's very easy to tailor it specifically to every patient. So I'm just going to massage it. So that's what I'm going to do now. I'm going to have you just open slightly. Good. And I'm just going to feel and make sure that it's nice and smooth, and it is there. And then do the same up here. Okay. And she's done. So
Yay!
we have some filler left for her, and since this is her first time, we're also going to do touch-ups in a couple of weeks, so we're going to save that for her. We're going to label it and keep it for her to use it next
And we
time.
actually have a question. How much does Restylane Kysse cost? And
So the cost of Restylane Kysse is $6.50. It's different this week because of our promotion, but normally it's $6.50 for one vial. One vial is roughly, well, it is 1 cc. But again, you may not use that entire CC at your visit, so especially if it's your first visit, we're going to save that to make sure that once the swelling goes down, you're not actually wanting more in there. If you have like 0.1 left, you know, maybe we won't, but she has a better part of a syringe left, so we'll save it and then do little touch-ups if we need to. Otherwise, the expiration date is 2022, so she can use it for touch-ups even down the line.
And then it's 25% off this week. 2 more days.
2 more days, so today and Friday.
So get your call on.
Yeah. If there are any other questions, we can take them now. Otherwise, we'll hopefully see you in the office.
All right. Thank
Thanks for
you.
joining, everyone.
Thank you for letting us do you guys live, too.
Thank you so much.
You're welcome.